Hi guys, so before I begin, I just want to let everyone know that I do have a cold and my throat is killing me right now, so I'm going to try my best to talk through this, but I might have to stop or cough or whatever. So, but I'm going to try my best. So, my name's Marina. I'm a human development major and a health science minor. My biggest reason for taking this class was so I could learn more about current health disparities and how I myself can help to prevent them from occurring. Although several of the topics we've discussed have interested me to some extent, obesity was what caught my immediate attention. With a basic understanding, it's evident that obesity is one of the most prevalent and detrimental diseases to exist worldwide. Seeing the impact it's had on the world and how rapidly it's spread gave me more reason for wanting to explore the topic. Therefore, I chose to focus my topic on obesity. I decided I'd explore the obesity prevalence among African American individuals and what their experiences had been with access to healthcare. Historically speaking, access to healthcare has been very difficult due to several overarching factors, one being residential segregation. At one point in time, races were segregated into different neighborhood environments, which typically included either a white or black community. Since then, it has been difficult for blacks and whites to integrate into other communities, whereby blacks move to white communities and whites move to black communities. Despite efforts to decrease this segregated community, family moves are still showing that white families are moving elsewhere, yet in the same white neighborhoods, and black families are moving elsewhere, but in the same black neighborhoods. More than likely, this means that blacks don't have very much access to healthcare, since most blacks typically live in poor neighborhoods where healthcare is not provided. Um, Thus, prevention services are not being provided to those people in black communities who have obesity. But those in white communities do receive more healthcare services because most reside in areas that are better off financially. Therefore, whites are much more likely to be treated for heart disease, mental illness, kidney failure, etc. With residential segregation still current in today's society, decreasing racial disparities in health is going to be very difficult to do. Statistically speaking, 36.5% of US adults have obesity, and childhood obesity has more than doubled in the past 30 years. As I mentioned before, blacks are at the highest risk for obesity. Blacks' rate of obesity is at 48.1%. Hispanics are at 42.5%. Whites are at 34.5%, and Asians are at 11.7%. Although I believe some cause of obesity relates to genetic factors, I still feel there are much more significant factors that influence the disease, such as race, ethnicity, and socioeconomic status, much of what we talked about throughout our course. It seems as though certain races and ethnicities get very little attention in regards to healthcare, and I'm sure you know why, but there are known racial genetic risk factors, and supplying those who are at a disadvantage with the right medications would supposedly be a waste of time, so some doctors say. The other reason is they have lack of access to healthcare. With little to no education, it's typical for blacks to find themselves battling poverty every day, often in locations where health facilities don't exist at all. Not living within fair distance to healthcare clinics then means that care is impossible for them to get. So therefore, lack of care stems from racial bias and socioeconomic standing, as well as other factors too. Although there have been several interventions and research studies done to prevent these instances from occurring, it does not seem many have been successful, seeing as how obesity is increasing more than ever before. I think that several good ideas for obesity prevention have emerged over the years, but they need to be taken to the next step. For instance, a program called Let's Go was shown successful after it exposed families and children to consistent health messages in multiple settings to remind them how to make healthy choices. Yet, the community-based obesity prevention program needs to be sustained in order for the program design to be effective in decreasing rampant rates of obesity. Therefore, I recommend that we grow on interventions that have shown to be successful in years past, such as the Let's Go program. By creating awareness of what is healthy and what is not, this program has great potential in preventing obesity. Yet again, this program would not be as beneficial for someone whose obesity stems from racial and ethnic issues. For these reasons, I recommend designing programs that provide those of low socioeconomic standing with opportunities to obtain the resources required for better health. I did find it surprising how there weren't many obesity prevention programs that associated race and ethnicity, but I suppose that designing programs that target doctors and pediatric physicians could be very beneficial for these reasons, since doctors are typically the ones that have biases against minorities and other assumptions that keep them from caring for certain individuals. If doctors and pediatric physicians did understand how big of an impact they have on today's obesity prevalence, maybe more prevention programs would be designed for doctors rather than the victims themselves.